Welcome to Nurse Discussions. So, man, what do you want to talk about today?
Well, there was that incident.
This
At the beginning of this month, on the 7th, 7th of November, 2014.
That's right.
There was that patient that took the railing off of his bed and started beating on the nurses.
Oh my God!
Did you see that?
That guy was nuts. He was cray-cray. He was off his meds, or maybe he was on too much meds. I have no idea, but that fool.
We're gonna put the video link right over here.
It's on the bottom. Check out the description. You're gonna check it out a little later.
But yeah, man, I don't know. I feel bad for the guy. Here's a few of the details that we know. We know that the patient ended up dying.
Yep.
We do not think that he was shot or anything like that. The cops did try to use a taser on him, but it didn't make contact, so that wasn't it.
That's what they say, right? Okay.
Yeah, that's what they say, is that the taser was ineffective because it didn't make contact.
Go ahead.
And then the family is also saying that this is totally out of character for him. Even some of the nurses were saying that.
Something new, right?
Yeah, this is something new.
And what's crazy to me is how this guy could just randomly just come out of nowhere and grabs, I don't know, it looked like a freaking Jerry Maguire or Mark Maguire, I'm sorry, bat. He starts swinging on people and just coming out the corner, just crazy. I honestly thought it was an undiagnosed mental disorder. I don't know if it was paranoid schizophrenia. I don't know. It was probably something that was undiagnosed, or like you said, it could have been something.
Yeah, I mean, like maybe he was stroking, and the part of the brain that was affected was the personality part, or maybe he had a tumor that was putting pressure on that same section. Who knows?
But did you see the railings on the bed? They were so high already.
I know. This guy was obviously strong.
Yeah. And another thing is that bed, the way it looked, it was already not 4-point, but it was a restraint because both railings are up. You're supposed to have one, so that considerably shows.
At least that's what they showed in the video from CNN.
Yeah, and I mean, if he took it off, did a nurse hear it? I mean, don't you think it would have been loud enough to hear that railing? That thing looked straight metal. I mean, you would hear some clanging noise. Yeah. Or even if it was going into that escalation phase, don't you think the nurses would have caught the first part where they're angry, frustrated, yelling? This patient just skipped all that and all of a sudden goes into a straight escalation phase and starts swinging on people. I mean, to me, there's a lot of red flags that could have been maybe found by the nurses, or they were so busy they didn't catch on, or like you said, a stroke, maybe something where it hit part of the brain and just the patient got nuts. That was crazy, dude. That was crazy. Now, you were saying security. What the hell? Where was security?
Yeah, I know. Well, and if you think about it, how many hospitals are going to be putting security guards on every floor?
Yeah.
I mean, I don't even think that that's a good idea.
No.
To tell you the truth.
Yeah, you're right.
I mean, because like if you think about it, how secure would that really make a patient feel?
Yeah, that'd be more nervous.
Yeah,
I'd be more scared there's someone watching over me.
Exactly. So, but what was that statistics that we heard from CNN?
It was the International Healthcare Security and Safety Foundation.
There you go.
Ooh, I sound smart. Tip to that. Said 60% of most of the assaults happen in the healthcare field. 60%.
60% of the work-related assaults or something.
Yeah,
happen in healthcare.
Dude, that's more than 50.
That is crazy.
Now. I wouldn't want to work there.
I mean, where that comes and hits home with me is that this is not a safe. It can be a potentially dangerous job.
It could be, and different places have different security, and some hospitals don't even have security. So, what would you think the best bet is?
So, I mean, by watching that video, it looked like it was all females.
All female. It was
all female nurses, and I love my female nurses.
Yeah.
I think that we are not we are not trying to sound sexist by any means. However,
they should have at least one male nurse.
Well,
a couple male nurses.
I think that all it does is show a little bit of testament as to how valuable we could be.
Yeah, no.
I mean, dude, if that happened while on our unit, while you or I or both of us were there, that guy wouldn't have made it to the door.
No, man, I would have thrown my body protecting the patient over a bullet like this.
Yeah,
I don't know about all that, but I mean, I would help the patient.
Yeah, obviously, we don't want to hurt the guy.
No.
But I don't think that should be at the expense of a nurse getting her lung blown and she has to be hospitalized. You know?
So bottom line, get a male nurse in your unit, or get some other people, some security, someone to help out, because that was running for at least 2 minutes. Security should have showed up there, and no one showed up. There was no male nurses. And what happened to that nurse that got hit? She got a collapsed lung?
She got a collapsed lung.
Oh my God.
And then another one got beaten on the back or something like that.
Yeah, was wailing on
And the guy made it outside.
Yeah,
you know, he made it outside. That's where the cops caught him.
And what's scary is that puts other patients for potential risk of harm or anything that could happen to them.
Yeah.
You know, that's scary, dude.
Yeah, and so, you know, I mean, that's how I feel about it. Is I don't want to say anything negative about our female nurses. I obviously we need them all.
We do.
But when you have a male nurse,
we need more males. Period, y'all.
Yeah, when you've got the male nurses on the floor, you've got another level of security.
You do, and a lot of people stand down when they see someone with testosterone coming up. And it don't matter if you're scrawny or if you're buff or as long as there's a male there to help out, that makes a huge difference. I would have to say recruit more male nurses. Don't get any more crazy patients, and if they are, learn the freaking learn about what's going on with the patient. Learn if there's an escalation phase. Learn about that. What's going on, y'all? My fellow YouTube nurses. Deuces. I really thought that was a video, dude. Hold up.